Hi, this is my presentation for Wednesday, July 19th, 2023, and it is titled Variations in Metabolic Risk Factors for Dementia Do Not Affect APOE-mediated Cognitive or Functional Decline in Patients with Alzheimer's Disease from São Paulo in Brazil. Midlife cerebrovascular risk, low education, and copies of APOE4 are risk factors for Alzheimer's disease, whereas metabolic derangements have been associated with dementia onset. This study aimed to explore the impacts of variations in metabolic risk factors for progression of Alzheimer's disease in São Paulo in Brazil. The learning objective is to demonstrate genetically mediated impacts of metabolic risk factors for dementia on progression of Alzheimer's disease. We had all patients with Alzheimer's disease who were assessed for APOE haplotypes and variations in 1 year of the following potential metabolic predictors: fasting glycemia, TSH, free T4, vitamin B12, and folic acid. After blood was collected from all patients, genomic DNA was extracted using a standard salting-out procedure for determination of APOE haplotypes. Genotypes were genotyped by real-time polymerase chain reactions using Taqman and SNP genotyping assays, following the standard protocols of manufacturer. Metabolic variations were assessed in accordance with concurrent variations in the clinical dementia rating sum of boxes, the index of independence and activities of daily living, Lawton scale for instrumental activities of daily living, and the mean state examination in multiple linear regression models for all patients, and after stratification according to APOE4 carrier status. We had 122 patients. There were 81 women and 69 APOE4 carriers. The mean estimated age at dementia onset was 73.13. We had 120 patients who used a cholinesterase inhibitor and 90 patients who used memantine. All test scores were significantly different at the end of 1 year, except for the mean state examination. None of the potential metabolic predictors varied significantly after 1 year, and no variations in metabolic risk factors were concurrently associated with variations in the clinical dementia rating sum of boxes, the index of independence and activities of daily living, Lawton scale for instrumental activities of daily living, or the mean state examination, neither for APOE4 carriers nor for APOE4 non-carriers. In Table 1, we can see clinical and demographic results. In Table 2, we can see variations in metabolic parameters, and in Table 3, the multiple linear regressions, which were non-significant. So, in conclusion, lifetime metabolic risk factors may affect onset of Alzheimer's disease, but concurrent variations in metabolic parameters seems to have no associations with cognitive or functional decline in such patients, regardless of APOE4 carrier status. Thank you very much for watching, and I hope that you have a good conference.